All right. It is Friday, April 24th. Welcome back into the Keep Boone Healthy podcast channel. And I'm David Jackson with the Boone Area Chamber of Commerce. Once again, we're pleased to be joined by Congresswoman of the 5th District of North Carolina, Virginia Foxx, who just last night was part of the group in the House of Representatives that passed the latest stimulus that will help fund the CARES Act loan programs that we've been talking about so much on these channels. Congresswoman, thank you for joining us again. I know another late night for you, but some action taken by Congress to help refund some of those programs that got access so quickly as people need the capital. What can you tell us about your actions yesterday?
Well, David, the Paycheck Protection Program was a lot more popular than folks thought it would be from the beginning. I thought it would be very popular. Coming from a rural area and knowing how many small businesses we have here, but it was way more popular. Unfortunately, we had about 4 million people lose their jobs, 4.4 million people lose their jobs in the last week or so, while Nancy Pelosi held up our doing this. It really was unfortunate. We knew several days in advance that the program was going to run out of money, and the Senate tried very hard to do this by unanimous consent, which meant that it could be done very quickly. And it basically is just an extension of the Paycheck Protection Program. So our members supported it who voted for the original bill because that's what it is. The total amount of money in the extension is $310 billion. Now, we know a lot of people applied and didn't get their money before the money ran out. Hopefully they have their applications in somewhere, and that the money, as soon as the president signs the bill, and he'll sign it today, there's not going to be any delay in signing this. We did pass it late yesterday afternoon, and it was pretty unanimous. I think there were 5 people who voted against it, and we had 1 person vote present, I believe. So interestingly enough, Alexandra Ocasio-Cortez voted against it. I guess she voted against it because it wasn't doing enough. Some other members voted against it on our side. I had to rush out to try to catch a plane, so I didn't look at who was voting no. I knew 1 person who voted no, and his objection was that this funded drone programs, also continues to fund drone programs, and he is very concerned about that. I am concerned about that too. I do not want the government to be able to take my temperature from afar. I think it's a violation of the 4th Amendment, and I'm very concerned about those kinds of provisions. And that's something we all have to be concerned about when any bill passes. As I tell constituents when I talk to them a lot, many times a bill is 50% good, 50% bad. And you have to really work hard to decide, does the good outweigh the bad? But there's never a perfect bill. Well, I shouldn't say that. I've had a couple of perfect bills, but very seldom does a bill get passed that doesn't have something that you don't agree with in it. And I was told early on, the safest vote ever is a no vote, because if you know there's something bad in it, there's probably a lot more bad in it. But I'm mindful of the fact that there are a lot of small businesses out there who are hurting through no fault of their own, because our government made a decision to save lives, and this is a Solomonic decision, in my opinion. It's one of the most difficult decisions, other than going to war, that any government or government official has to make. Do you want to shut down the economy in the hope of saving lives? Well, I'm proud of the fact that most of us do vote for life. And not everybody votes for life of the unborn, but we do vote for life. and we have a very strong pro-life president. So we voted for life, and we're trying to do everything we can to protect life, but that has hurt the economy and it's hurting individuals. So with that background, $310 billion for the Paycheck Protection Program. It brings the total program number to $670 billion. Now, one of the questions I keep getting asked is, do I think there need to be more phases of this? We have questioned the Treasury Secretary several times, saying we don't think there is the appetite for going back and back and back to add money, so that we want to make sure this is going to be enough. They have said yes. Many of us are skeptical about that because the program is so popular. But let me go into what is in the bill a little bit more. So 30 billion of this money is for loans made by the smallest financial institutions, community banks, small insured depository institutions, and credit unions. 30 billion is set aside for loans by insured depository institutions and credit unions that have assets between 10 billion and 50 billion. But I think what's important for people to know is that of the loans that were made, 74% of them were for under $150,000. So that truly does cover small businesses. And that's a little synopsis of what's in the bill. I'm going to send you a pie chart that's pretty small for me to read from, but that you can put on your website to show where the money has gone from what's already been spent.
Some of the discussion around the first round of stimulus and some of what we've heard even the government get involved in and try to gain some of these funds back came from larger corporations that got access to some of that money. And that, of course, ruffles the feathers of smaller businesses that were not able to get access to any funds at all. Were there any provisions in this latest round that maybe addressed who gets access to what funds? I know you mentioned the bank size as a part of that, but as far as the individual applicant goes, are there any changes to what will be looked at from that perspective to make sure that the ultra small business has an opportunity to get access to this?
No, again, in order to get this passed in a hurry, you know, we are not working in what's called regular order, David. This is not the right way for deliberative bodies to operate. We're only doing this because it's an emergency. And the only way that they could get the support for this, really, I think from both sides, but I'll be honest, particularly from Republicans. Republicans take this extremely seriously, and we don't believe in just writing blank checks. We want hearings. We want the chance to ask questions. We want, just like you're asking me, we want to be able to get things clarified. We all know you sometimes act in haste and repent at leisure. And the first legislation was written in a hurry. That's what we don't want to have happen. And it left loopholes in it for large industry or large businesses to get money. That's not what the legislation was intended for. But that's what happens when you do things in a rush. Now, I think what everybody's counting on is for the president to shame those people, or for it to be made public that certain companies are getting money. We've all heard about Harvard getting money with its $40 billion endowment. Harvard gets more dollars from the taxpayers than any other institution in this country, I believe. And yet it's sitting on a $40 billion endowment, which is now going to be taxed as a result of the tax cut bill, because it has offended so many people that we poor taxpayers are giving money to Harvard. when it has a savings account. So that plus some large restaurant corporations that have gotten money. What we hope is to be able through scrutiny and through the public knowledge to keep those people from applying and getting the money, and really leaving this money for the people who need it. The people you and I know who are suffering, who have small businesses and are the backbone of our economy.
There was certainly the PPP loan has been probably the most popular of these loan products. There was another loan that the SBA was able to fund, the EIDL loan or EIDL, and that was another one here locally that a number of people got access or tried to get access to in some cases. Is that another part of this bill to add any money to that, or is that left unchanged with this recent action of yesterday?
I think that was left unchanged, but I don't believe that program has run out of money. I believe that's why.
Okay. Final question for you. You obviously
let you know. Sorry.
Okay. Okay.
Let me make a note of that.
Okay. We'll certainly pass along anything else that you share with us on that. Final question for you. You represent a district that for the most part is very rural. And I know your district for your reelect has changed a little bit, but speaking about who you are representing now, what are the things that you continue to hear that you see as pressure points for this area? And certainly with stay-at-home orders extended for another bit of time, but then some clear direction as to what will be the next steps. Hopefully we're getting to the point now where we're going to be with good progress from a health perspective, getting ready to come out of some of this. Where are the pressure points that you have tried to identify, and that some of your colleagues that represent similar areas are finding that there are real concerns that from a governmental standpoint you're trying to address?
Well, it's more at the state level where the problems are, David. We've provided at the federal level the dollars for the Paycheck Protection Program, for unemployment and those kinds of things. We've done our part. Now the state and the governor and the local governments have to do their part. What I am hearing is great frustration from people, particularly in this area where there have been so few cases and so few deaths. Now, I started out by saying we are a pro-life group. We don't want to take for granted any life that has been lost by this, but it looks as though there are going to be fewer deaths from this than there have been from the flu in most years. And so the credit goes, as everybody says, to the American people for having been smart. I take credit, it's not my credit, but I give credit to the people in this area for being particularly smart and having practiced good conditions by washing their hands and being safe distance and following the rules. But I think people are ready to get out. I really do. And I think people have learned a lesson, and that we should be opening up our state. I truly believe that, because I think people will do the right kinds of things. I disagree with the governor in keeping things locked down for another couple of weeks. I think that we should open up with people being asked to do the right kinds of things. Now, we all know not everybody obeys the rules. I often say we probably wouldn't need a single other law if we simply obeyed the 10 Commandments. But we haven't been doing that for thousands of years. But I do believe, again, that people were frightened. The quickest way to frighten people is to frighten them for their health, because I think we all know if you have good health, you can contend with almost anything else that you're dealing with. And so that, I think most people feel that way. But life is a bit uncertain. So I think the biggest issue is how can we get the country back open? And particularly, how do you get our state open, which has so few instances of cases and death? You know, many states out in the Midwest never shut down. I think I heard Wyoming, which never shut down. Now, Wyoming's the smallest populated state in the country with a large area. I think they've had 7 deaths. I believe one of my colleagues told me at the airport last night, 7 deaths in Wyoming, and they never shut down. So I think the quicker we open up the country, the quicker we open up the state, the better off we'll be.
One kind of a quick follow up to that, and you mentioned earlier that you had flown back from DC last night, and there are so many people that are used to that kind of travel that haven't been doing that lately. From a national perspective, and certainly this will get into what states have allowed what things at some point in time. But as a national perspective, has there been much conversation amongst Congress members and maybe even higher up about what domestic travel looks like as states begin to relax policies and any types of issues that may come up from, say, the hot spots? That's one of the terms we hear these days about limiting travel from certain areas to other areas. I know you know this all too well. This is an area that depends on tourism quite a bit. Do you see from your seat anything that would restrict access of people that wish to go once they're allowed to do so where they want to go?
We haven't had any conversations about that. And again, I believe that one of the things that you'll see happening is there will be additional concern about the hot spots. And I think that there will be areas where they'll say, like they have done, if you're coming in from New York, there have been some states who said, if you come in from New York, then you're going to quarantine for 2 weeks. I think, again, once we learn more about how this is transmitted, we learn better how it's transmitted and what's the immunity out there. I think finding out yesterday that maybe 15% of New Yorkers have now the antibodies, and yet the death rate even in New York has been very small. We'll find that we're not transmitting this as much as people think. David, I think probably people have told you, I've been in the grocery store several times in the past few weeks, and I keep running into people who've come up here during this period of time to get away from hot spots. Mm-hmm. And again, we have not seen a great increase. I mean, I live right across the county line from Avery County. Avery County hasn't had a single case. And they've probably had as big an influx of people from the quote outside as most counties. I mean, the resorts there, people are flocking to their second homes there to stay there and get away from the bad spots. And yet people are being smart. Now, I will tell you, we are a social people, and I think God intended us to be a social people. You know, He created song and dance and all of those things for us, and we enjoy them. So I hope we don't become the book Bowling Alone. I just don't think we need to do that. I think we want to be together again. And so I'm hoping with good practices, washing our hands and making sure that if we are sick or possibly contagious, that we will stay away from others to protect them, that we'll be more healthy people. The other thing is, we have to pay attention to the fact that most of the people who died were elderly and had an underlying problem. And sometimes I love the theme you've used, healthy Watauga. I love that theme because it is truly what we have to focus on. And if you listen to much TV, particularly, you'll see the emphasis on this. We all need to be healthier. We need to bring down our blood pressure. We need to control our diabetes. There's more, I've forgotten the exact amount, but I'll get you some figures on this. We spend more on the last 18 months of life in this country for health care than any place else, because we do our best to save lives, but it's because of diabetes, high blood pressure, and heart disease. And those primarily are things under our control. We primarily can control those diseases. not completely. Some are hereditary, and God bless the people who get them, but many of those people do take care of themselves. Anyway, I think there are a lot of things we can do.